was established by the government. And interestingly, electronic city started well before there was internet and well before we became familiar with the software. It was an amazing thought by the government, extremely well implemented, covering over 800 acres of land with some of the brightest minds on the planet working. And electronic city led to the startup innovation activities and many, many billion-dollar enterprises. And as you drive from Bangalore city towards electronic city, I call this road as the knowledge corridor. It is a knowledge corridor because on the way to electronic city, you find many, many buildings harboring many, many startups, many, many mature companies. Then after electronic city, you come across Biocon, which is considered as one of the world's top biotechnology companies and its cluster of activities around that area. So we have electronic city, then we have biotech city around Kiran's Biocon. Then you drive further down, you have Narayan Hrudayalaya Health City, which is covering about 30 acres of land with 5 hospitals, with thousands of patients coming from across the world seeking medical care. So together, they form a very formidable combination of knowledge-based cluster of activities which can perhaps change the future of the world. How all these things happened in Bangalore? It happened mainly because of the foresight of our government and the policymakers and entrepreneurs the state has given birth to. We have one of the largest number of engineering colleges in the country. And these engineering colleges produce thousands of young engineers, brightest engineers. They are the ones who are powering some of the top software companies, biotech companies across the world. Then Karnataka state boasts of having the largest number of medical colleges in the country. So we produce some of the brightest doctors who are today stars of healthcare delivery in US, Europe, and rest of the world. We have one of the largest number of nursing and paramedical institutions. With this, Karnataka state and Bangalore especially has emerged as a city for caring, city for innovations, and city which can design the future of the world. And then we have Indian Institute of Sciences, National Law School, and many, many such institutions, which makes it extremely, extremely attractive. Why startup? We need startups because startups are generally started by young people who do not know what is not possible. In their mind, everything is possible. And that is the state of mind which changes the world. I'm so happy to know that the IIM Bangalore is now thinking about a large innovation cell for startups in healthcare. Why it is important to have startups in healthcare? Because there is a serious problem in delivering healthcare. You may not be aware that global healthcare and wellness industry is a $8.2 trillion industry. It is the largest industry in the world. For your knowledge, the food industry, agro industry is only $8 trillion. We spend more on maintaining our well-being than sustaining by eating food. Everyone thinks automobile industry is a big industry. It's hardly 2 trillion. IT is 3.4 trillion. It's a huge industry. But the tragedy is, after spending $8.2 trillion, less than 20% of the world's population has access to tertiary healthcare, which is desperately required. Now, if tomorrow, if all the policymakers of the world decide it is unacceptable, let at least half the world's population have access to decent health care, we need $16 trillion, which doesn't exist in this world. Now, that means, are you going to resign to the fact that you're going to let 70 to 80% of the world's population to suffer and die? That is not acceptable. Now, who's going to change? Only the startups can change. You will change by changing the way healthcare is delivered. Let's look at three important things in delivering healthcare. Healthcare has to become safe for the patient. Today, healthcare delivery is not safe for the patient. In US, medical error, not negligence, medical error is the third leading cause of death in US. It is much more than road traffic accident or breast cancer. We want healthcare to be safer for the patient. We want hospitals to become safer. Only startups can do it. We want healthcare to be affordable by reducing the cost. For that, we need to change the way healthcare is delivered. You can do it. And we want healthcare to access everyone, whether they are living in the city or in villages. It is possible. It is possible with telemedicine becoming a reality in the country. It is possible. Thanks to COVID, a lot of good things also have happened in the country. Technological breakthroughs in healthcare, which would have otherwise taken 5 to 10 years for the government to legislate and the people to accept. Instead of 5 years, people accepted in 5 weeks. And today, half my patients see me sitting in their bedroom in remote locations of the country. All this transformation to happen, we need one thing. If you are asked as a young entrepreneur, if you want to change the way healthcare is delivered, if you are going to make healthcare safer for the patient, affordable to the patient, accessible to the patient, and you are asked to do only one thing, what you will do? What you should do is to remove the pen and paper from the hands of doctors, nurses, and medical technicians and give them a smart digital tool to deliver healthcare. And that will take care of the rest. Believe me, once we have software which is guiding all the medical care, healthcare will dramatically undergo change. I have no doubt that smart software will make smarter diagnosis than doctors in the next 3 to 5 years. In 5 to 7 years, it will become legally mandatory for every doctor to get the second opinion from the software before starting the treatment. This is going to happen. No one can stop it. Now, how will it happen? It will happen if all of you believe that it is going to happen, and we are the people, we are the agents who are going to make it happen. And that is your responsibility. Now look at a regular house. We started off with glucometer to check the blood sugar in houses where there is a diabetes. Today in every house there is a digital thermometer. Most houses today, thanks to COVID, has a pulse oximeter which can give the knowledge about how your lung is functioning, what is your heart rate is, and you have a BP apparatus, you have a glucometer, you have a weighing machine. It is a matter of time before your house will be filled with gadgets. I wear a watch, and this watch gives me, any time I feel I am missing a beat, I have to just touch the button and it gives my ECG. And I'm worried whether I'm a little bit short of breath. Is it COVID? Because from morning till evening, I'm surrounded by patients. All I need to do is to touch the button and it will reassure me by saying that my oxygen saturation is okay. Now, it is a matter of time before every watch in the world will have all these tools. Then, when that happens, it is a matter of time before watch will give the diagnosis. and the doctors have to reinforce the diagnosis and guide the patient in caregiving process. Eventually, we will reach a stage wherein patient is going to take care of himself and the doctors are only going to guide them. I just want to explain to you that if you think that the healthcare has done a fantastic job so far, I agree, you're right. But is there something more needs to be done? Believe me, we have only touched the tip of the iceberg. Now, if you want healthcare to become accessible, affordable to everyone, you need to come up with new tools. And that will only happen if you all start collaborating with the hospitals. And in your venture to start something new, do not be obsessed in collecting huge amount of money to start off. Because in my experience, if you have lots of money, your brain stops working. Need to be very, very frugal from the very beginning. And the most important advice I have for all of you is that I just want to ask the coordinator, how many minutes I have?
Another 10 minutes.
Okay. So the most important quality of your startup being successful is the hard work. If you're going to enter the startup world and if you're looking for a work-life balance, you forget it. You're not going to reach anywhere. At this stage, I work for 12 to 16 hours every day. And if you do not have that eccentricity, do not get into this area. Work-life balance is people who want to get into that sphere. Let them not, God didn't create everyone alike. A lot of people value work-life balance. What work-life balance a young soldier has on Siachen Glacier? So essentially, these are the paths, these are the choices you all make. And once you make a choice, do not compromise. And never get disheartened when you fail. Failure is part of life. And if you ask me what are the new things, what I need in healthcare, I need drones. I need drones because city like Bangalore, why do we need 50 blood banks? We just need 2 or 3 blood banks. All we need is a blood bank which is surrounded by drones, and every hospital, they have to just send a message to the blood bank and the drone can fly the blood in Bangalore city in less than 15 minutes. Why do you need so many laboratories checking the blood and various tests? We need few labs and rest can be collection centers. And we need robot. And why do we need robot? In our one hospital in Bangalore, where we have 300 critical care beds, at any given time, there are at least 50 young girls running around taking one syringe of blood from the bedside to the blood gas machine. They don't do any intelligent work. They just carry the blood samples from a syringe. I need a drone which is designed like a toy. I need a robot which is designed like a toy, which can navigate itself in the ICU, come out of the ICU, go to the blood gas machine, and somebody will do the blood gas report, and the robot will go back. And I want it to be available for 50,000 rupees. Then I will buy few thousand of these drones. But important thing is do not try to create something which is costing 10 lakh, 20 lakh rupees. That's not what I want. This robot can stop functioning. I can have 10 the extra drones to supplement, but I want the job to be done by the machine. Is it because I am trying to save money? No. I cannot have people working near the patient with all these infectious diseases coming. Every person entering the ICU is risking himself or risking herself or risking others if they are carriers. We want in a hospital only doctors, nurses and medical technicians to work. All the rest should work from home, online. So I need all these gadgets. Now I'll go completely away from my industry. I want you to design a fire sensor which can detect fire when it happens. At any given time, when I have 300 patients in the ICU, at least 200 of them are dependent on the life-saving machines like ventilator, ECMO, balloon pump, all kinds of supports. If there is a fire, how do I evacuate them? Evacuation in a specialty hospital is not an option. Now, I did a lot of study on fire sensors, how to come up with a new technology, and I was horrified to know the fire sensor in India, US, Europe, what we have so-called which we see in every room on top of the roof, that was invented in 1892. Since then, there has been no innovation in detecting fire when it happens. That is stupid. When the fire happens, it emits light. There are light sensors. It emits heat. It changes the wave of the air flow in the room. There are 10 different sensors you guys can come up. A fire sensor, there is smoke detector. I'm sorry, it's not a fire, it's a smoke detector. Smoke detector in an air conditioning room will never detect smoke until the whole room is filled with smoke. Because air conditioning room, all the smoke is sucked out by the air conditioning system. So why this hasn't happened? This hasn't happened because the end users like us, we haven't got an opportunity to discuss and spend time with the people who can make things happen. So it is a phenomenal opportunity you all have. There are so many big hospitals, and I take the personal responsibility of bringing all those hospitals to invest on your company or guide you. But more than the investing, what you need is a customer. When you come up with a product, you need somebody to use the product and give the feedback and make it like a product which has a market value. And all those things, with our contacts, we can make it happen. Once again, I'm so happy that you all have decided to walk in this path. Good luck and God bless. And I would like to congratulate the entire team of IIM Bangalore for making this happen. Thank you so much.
Thanks a lot for this talk and the fact that you highlighted